All right, so now we're on to chapter 16, and that's over general pharmacology. Medications are carried, some medications are carried on the ambulance, and these are four that are in the EMT curriculum that most places carry on the ambulance. Medications might include aspirin, oral glucose, oxygen, and activated charcoal. This is aspirin. Aspirin is administered to patients that have chest pain, which is suspected to be cardiac, like a heart attack. Aspirin is given not to thin the blood, but it keeps the platelets from sticking together. Platelets are what help the blood clot, and it's a good thing to have your blood clot if for some reason you were bleeding, you would need for it to clot. But when you're having a heart attack and you want your blood to flow easily around the coronary vessels and around the heart itself, you don't want it to clot and that platelets getting sticky and clotting will cause that clot to build up more. So aspirin is what they call, it stops platelet aggregation. It stops the platelets from sticking together. Glucose. Glucose is given to increase the blood sugar in patients that have diabetes. So anybody that's diabetic and they're alert might get oral glucose. It's a thick, sticky gel that tastes very, very sweet. Oxygen is considered a medication. You can either give it via nasal cannula or non-rebreather or even a bag valve mask. And activated charcoal. This is used for poisoning cases. It's fallen out of favor quite a bit and isn't used much at all. And in fact, on our ambulance, it is not carried and not utilized. A bronchodilator inhaler. This is a prescribed medication that's prescribed specifically to a patient that has respiratory problems, and you can assist them in using their own inhaler. It's not generally carried on the ambulance. So, prescribed medications that you can assist the patient with taking include inhalers, nitroglycerin, and epinephrine. That's according to the EMT curriculum. Now, on our ambulance and in our protocols, we do carry these on board, and the EMT can give them with an order from medical control. Bronchodilators are used in patients with asthma, emphysema, and chronic bronchitis. What it does is it enlarges the constricted bronchioles, the smaller portions of the airways in the lungs. So it keeps those tubes open. There are some side effects. Bronchodilators dilate the bronchioles, but they act a lot like the hormone adrenaline. In fact, they stimulate the sympathetic nervous system, which causes your heart rate to go up, and it'll cause the patient to maybe be a little bit jittery. But it's worth it when the bronchioles are dilated and they can breathe better. Nitroglycerin. This is prescribed for chest pain. It can either come in a spray or it can come in a little tablet, but both of them go underneath the tongue because under the tongue it's very vascular and absorbs into the bloodstream easily. What this does is it relieves the pain, but the better action is that it dilates the coronary vessels, makes them bigger so that the blood can flow through more easily. So if you give nitro and they've chewed 4 baby aspirin, not only is their blood not sticking and flowing easily, it is the vessels are also dilated so that the blood can move through it easily too. Nitroglycerin is taken by patients with a history of chest pain or of cardiac origin. It helps dilate the coronary vessels. Contraindications to taking nitroglycerin is if the patient has a low blood pressure or if they're taking medications for erectile dysfunction, something like Viagra, Levitra, Cialis, or anything like that. They can't have taken that within 48 hours to taking a nitroglycerin. So this is a very important question to ask people, and make sure they give you an honest answer, because if you give them nitroglycerin and they've taken one of the erectile dysfunction bloods uh, pills, they can actually pass out and their blood pressure can drop dramatically. And then you have a serious problem under your hands. Blood pressure will drop using nitroglycerin, so they have to have a systolic blood pressure of at least 100. Epinephrine autoinjector. This is for a severe allergic reaction, one that is called anaphylaxis. This is epinephrine, which is adrenaline. Epinephrine autoinjectors are prescribed and used for patients with severe allergic reactions, which we call anaphylaxis. What does it do? It's a vasoconstrictor, so it constricts the vessels and it relaxes actually the airway passages. The bronchioles will dilate. So it constricts the blood vessels but dilates the bronchioles. It relaxes those muscles in the bronchioles. Side effects to that is an increased heart rate and also a better blood pressure because the vessels have constricted. Another drug that we can give is something called naloxone, or the other name for it is Narcan. This is an antidote for a patient who is unconscious and in respiratory failure after they have taken a narcotic drug overdose. It does not work if the patient has not had a narcotic, though. You can sometimes run into something called force protection medications too. Atropine autoinjector will treat any responders in the event of an attack. So if there's an attack from a terrorist and there's nerve agent that's been dropped on everybody, you could actually have an atropine autoinjector. They call it a duodote that you can give yourself to survive an attack from a nerve agent.
The brain is very sensitive to low levels of sugar. Oral glucose usually comes as a tube of gel. Apply with a tongue depressor and place between the cheek and gum or under the tongue. Swallowed glucose is easily absorbed into the digestive tract and bloodstream, which carries it to the brain. Quick administration of oral glucose when the patient is conscious and can swallow is critical to reverse a potentially life-threatening situation.
So, some more general information about medications. Each drug is listed by its generic name, but each drug has at least 3 names. There's a chemical name, a generic name, and a brand name. For instance, EpiPen is a brand name. The generic name is epinephrine. The chemical name is adrenaline. So, one or more trade names can be given to the drug by manufacturers. So, EpiPen is the brand name that it's sold by, but there's other things that the other names and other companies that may sell it by a different name. You need to know what an indication is. That's a reason to give the medication. You need to know what a contraindication is. That's the reason not to give a medication. A side effect is something that happens that you really uh, don't want to happen, but you know it's going to happen, and it may or may not be a problem. Untoward effects is something you really don't want to happen. The form of the medications come in different forms: compressed powders or tablets, liquids, gels, suspensions like activated charcoal, fine powder, gases, or sublingual sprays. Medication, you need to be safe and make sure you give it for the right reason. So, administering or assisting with medications is a serious responsibility. Know the medication, know what it does, know what it side effects could do. Use good judgment in giving medication to people. Medical authorization is needed for drugs to be given. You can either have offline medical direction, which is in the form of standing orders or protocols, or you can specifically talk to the medical direction online and listen for an order, then repeat the order back. Ask for clarification if it's necessary. The 5 rights of drug administration. First of all, do you have the right patient? Is it the right time to administer this medication? Is this the right medication? Is it the right dose? Am I giving this medication by the right route of administration? So think about it. What would be the potential risk to the patient if each of the 5 rights were not checked prior to administration? Some of the risks can be very severe. For instance, if you gave nitro to somebody that had taken Viagra and their blood pressure dropped and they died. That's a serious, serious risk. There's right routes to give a medication: orally or swallowed, sublingual or dissolved under the tongue. You can inhale or breathe it into the lungs, usually as tiny aerosol particles, such as from an inhaler, or as a gas, such as oxygen. There's intranasal administration, it's sprayed into the nostrils, IV or injected into a vein, intramuscular or injected into a muscle, subcutaneous or injected under the skin. Intraosseous is an IV that goes straight into the bone marrow. And endotracheal is down the tube that's inserted into the throat. So, age and weight sometimes is always a consideration when you give medications. The pharmacodynamics is a study of effects of medication on the body. What effect will the medication have? How will it affect your patient specifically? And the patient-specific factors might change how a medication works. So after you administer a medication, be sure and reassess the patient. Clearly document medications that you give. Put medications that patients often take. Sometimes patients take medications for specific problems. Advair is a medication that may be prescribed to a patient for daily management of a respiratory disease. It usually isn't used for emergency treatment of an acute attack of breathing difficulty. And here's another table of herbal agents and what they are sometimes used for. You may find that a patient takes ginkgo or ginkgo biloba for dementia or poor circulation to the legs, or even ringing to the ears. St. John's wort is for depression. Echinacea, prevention and treatment of the common cold. Garlic for high cholesterol. Ginger root for nausea and vomiting. Saw palmetto for swollen prostate. hawthorn leaf and or flower for heart failure, evening primrose oil for premenstrual syndrome, feverfew leaf for migraine prevention, kava kava for anxiety, valerian root for insomnia. And sometimes an EMT will assist in IV therapy. So you might have to set up an IV fluid administration set. The way fluids and medications may be administered into the vein can be through an IV set or a heparin or saline lock, which is a catheter placed into the vein. The cap is locked off, placed over the end of the catheter, and the lock has a little port that you can give medications. The traditional IV bag hangs above the patient and actually constantly flows fluids and medications into the patient, still through an IV in the vein. Clear plastic tubing connects the fluid bag to the needle or catheter. Three important parts: there's the drip chamber, the flow regulator, the drug or needle port. And an extension set makes it easier to carry or disrobe the patient because you can disconnect the IV from an extension set. Inspect the IV bag to make sure it contains the solution that was ordered and it's clear and it doesn't leak and it has not expired. Set up an IV administration set. You need to remove the cap from the little, they call that the spike. And then you're going to spike the bag by inserting the spike in the end of the tubing and into the fluid in the bag. And once that happens, you open the flow regulator and you let the tubing fill with fluid. And then once the entire tubing is filled with fluid, you shut off the regulator. Okay, you need to have that all filled with fluid because otherwise you can get an air embolism into the patient's vein and that could kill him. So any flow plot problems, you could have constricting bands left in place by mistake. The flow regulator might be left closed, clamp closed on the tubing might be kinked, the line might be pinched under a backboard. Just look for those things if you can't get the IV to flow. And then adjust the flow rate properly. Monitor IV sets for any infiltration. And in review, aspirin, oral glucose, and oxygen are medications carried on the ambulance that the EMT may administer to a patient under specific conditions. Prescribed inhalers, nitroglycerin, and epinephrine in autoinjectors are medications that, if prescribed, the EMT may assist the patient in taking. You may be able to administer intranasal naloxone or encounter patients who have received it from a layperson. You may need to have permission from medical direction to assist the patient with a medication. Just follow your local protocols. There's a wide variety of medications that a patient may be taking. You will try to find out what medications a patient is taking when you do a sample history. These drugs may be identified by a variety of generic and trade names. Your main purpose in finding out what medications the patient is taking is to report this information to your medical director or hospital personnel, so don't freak out if you don't know a specific medication. EMTs administer aspirin, oral glucose, and oxygen as part of patient care. EMTs may also assist with prescribed inhalers, nitroglycerin, and epinephrine autoinjectors. EMTs should understand the names, indications, contraindications, and side effects of medications that they intend to administer. So study Chapter 16 in your book. EMTs need to have appropriate authorization to give a drug, and you always need to know the 5 rights of medication administration. Reassess and document. These are important elements of given medications. So, questions to consider. Should I administer medication? How can I get more information about the drug? What are the necessary steps that must occur after medication administration? So a patient is complaining of chest pain. Here's some nitroglycerin, says a family member. Give him that. What do you do? Is it the right drug? Is it at the right time? Is it the right patient? Can you give a drug that doesn't belong to that patient? I don't think so.